I think as a family, how you talk about this depends on the ages of your children, who's in your family. Those personality types may lend themselves to being a little bit more anxious or worried about things, but certainly talking about it is important, and we want to make sure our kids are getting good information from us as parents as well. We've talked about how we're staying at home, we're washing our hands, we're trying to keep others from getting sick, not putting a lot of emotion into that for maybe our younger children. Certainly for our older children who can appreciate, I think, the vastness of the situation. Again, being as factual as possible, but also appreciating that there are some emotions that come with that. And anxiety, worry, what does this mean for me personally, and what does this mean for my family? I think it's hard to explain the idea of social distancing to a young child. I think it may be helpful for parents to think about this idea that we're doing something to also help others. So in my household, explaining to my two girls who are very much interested in going outside the house, going places, eating at restaurants, maybe going to the movies, that we're going to stay at home now. It's to help keep germs out of our house, and it's also to help protect people in our community. So we're doing something for other folks. Social media is playing a very different and interesting role for us nowadays, as we're being encouraged and really recommended to limit our contact as much as possible with other people. I think that's driving us to use things like our phones and our iPads and tablets and Skype and what have you to talk to other folks. But I would encourage families to really be mindful of how much other information their older kids and teenagers, and even for ourselves as adults, are getting from the constant barrage from the news, from our Facebook feed, from text messages from family. That may be sometimes more anxiety provoking than helpful too. But I would encourage families to maybe think about what that screen time looks like for their families and for those individual children within their families. It may not be that social media is the best place for them to be spending a lot of the time. Maybe it's spending more time with an interactive game or a more educational TV show or movie time as a family. So that takes away from some of the, again, constant barrage of the news of COVID-19. There are still lots of things that we can do as a family, even with the recommendation to be social distancing yourself from other folks in the community. Certainly lots of things within the household that you can find to do, and this is one silver lining, is that we're getting outside, I think, more than we have been in a long time. So encouraging our families to spend some time outside on a walk. You can certainly walk with your family. You can ride your bikes as a family. Again, thinking maybe about who you're riding those bikes with, you'll want to think about that individual and maybe who they live with and make some decisions based on that. But again, walking, riding your bikes, exercising and within the household as a family, putting on some music and having a dance party, reading books. Those are all things that we can still do together. As we're keeping more disinfectants in the home, more hand sanitizer, alcohol-based products, I would remind families that have small children to make sure we're still following ways to keep our kids safe. Making sure those are stored in a place that's safe, keeping locks on the cabinets, just being more mindful that those things are probably going to be in our homes more routinely now. Soap and water is still best for washing our hands, but of course sanitizers, alcohol-based sanitizers, are the next step if you don't have that available. I think we still want to use the same gut feeling in terms of how our kids look when they're not feeling well. We don't need to take every child to the doctor that has a fever or every child that has a cough, but those severe symptoms or those kids that are not able to stay hydrated, not acting like themselves, we still want to follow those rules of thumb and make sure that those kids are evaluated if they need to be. I would recommend calling your doctor if you are worried that your child has a fever that's not responding, that they're having trouble breathing, that they're not hydrating, so that we can give you the best guidance to have that child evaluated.